Hello, hello everyone. Kimsey here. I am so excited to be here for our weekly live Monday Facebook Live. We've got an exciting topic for you today that I have a feeling everyone's going to be interested to learn about, and that is parasites. The creepy, crawly things that all of us wish that we don't have and hope that we don't and think that they're super rare when in fact they're not. But they're sneaky to detect and they can create a lot of symptoms that are also pretty sneaky. And so that's exactly what I'm going to talk about today is how to really fully assess someone or your history, your symptoms, your other lab values, because stool testing isn't really reliable when it comes to picking up parasites specifically. Love stool testing, don't get me wrong, going to talk about it today. But I'm also going to talk about its limitations when it comes to looking for parasites. And then we'll talk about if parasites are present, if they are suspected, then what is the protocol that we use, or the process, I should say, that we use to address them. So, for those of you that don't know me, my name is Kimsey Berkwin. I'm an integrative nutritionist in my online nutrition and wellness practice called Progressive Health and Wellness, where I work with ambitious men and women who are struggling with their mental health or in performance by taking a root caused body mind approach to optimize their overall wellness. So, parasites are far more common than most people realize, right? The narrative out there would lead you to believe that, unless you've traveled to a third world country, maybe eaten some undercooked meat, like in the street food or something in some third world country, that you probably don't have to worry about parasites, right? But that's not actually true. It's actually estimated about 60% of the adult population has parasites. And you can get them in a variety of ways: walking barefoot outside, drinking tap water, eating, of course, undercooked meats, eating produce that hasn't been thoroughly washed, transmission from, if somebody hasn't washed their hands after going to the bathroom, there could be fecal transmission that way. That can also happen onto food in grocery stores or kitchens or anything like that. They're also highly contagious. So if one family member gets a parasite, I'm thinking something like pinworms, for example, right? If one family member gets a parasite, the whole family needs to be treated because of how contagious they are. Do you have pets? Do you let your pets sleep in your bed? Do you let your pets lick your face? Do you kiss your pets? Right? There's a number of ways that parasites can be transmitted. So, when talking about some of the most common actually, I'm going to talk not just about the most common kinds, we're going to talk about two different kinds. So, there's two, for today's intents and purposes, there are two different categories of parasites that I'm going to be focusing on. And I'm talking specifically about GI parasites. So, there are blood-borne parasites, so something like malaria or babesia, for example. I am not talking about those today, just to be clear. Malaria, first of all, is very obvious. You're probably not watching this live talk if you have malaria. Babesia, on the other hand, is more common, definitely more ubiquitous. It's a frequent co-infection with Lyme. Hey, Whitney, thanks for joining. It's a frequent co-infection with Lyme. So that is something that is seen in the functional medicine world. But it would be a different approach than what I'm going to be talking about today, and frankly, different assessment than what I'm going to be talking about. So I'm talking specifically about gastrointestinal parasites. So two different categories. There are protozoan. Protozoan are microscopic. So, microscopic parasites. We'll just keep it at that simplicity. Some examples of protozoans would be Blastocystis hominis. So, actually, I should preface by saying some protozoans are actually considered commensal. So, what that means is normal inhabitants of the GI tract, believe it or not. So, just like we have commensal bacteria that are normal inhabitants of the microbiome, we have viruses and yeasts and parasites that are actually, again, normal inhabitants of our microbiome. So, Endolamax nana is an example of a commensal parasite. Now, in the case of commensal parasites, just like any kind of commensal bacteria, they can be opportunistic, which means if they overgrow, they can become a problem. But just their presence alone does not necessarily associate with a disease state or symptoms. So, Indole would be an example of that. Blastocystis hominis, where I was going with that, is mixed evidence. So some evidence supports blastocystis being commensal. Other evidence supports it being opportunistic. I think most evidence is pointing to it being opportunistic, which is more of that can be normal. So, what that means is there are studies that have looked at the stool tests of healthy people and have found blastocystis, but they don't see symptoms, they don't see other lab values that show that the body is treating this like a pathogen. So, that's why it's considered normal. Versus some studies also find that people with blastocystis can be symptomatic, can have suppressed immune systems, can show that the body's fighting it. And it mostly boils down to what the levels are. So blastocystis would be kind of that gray area one, but it can definitely be problematic. So those are some, and then there's Dientamoeba fragilis. So Dientamoeba is another one that's microscopic protozoan that is more on the infection category. An infection means the presence of a microbe that is never normal to have. It's never supposed to be there, as opposed to opportunistic, which means it can be normal to have in certain levels, but when those levels exceed that optimal range, then it can be problematic. The second category is helminths, and helminths are more of your classic worm. So they're macroscopic, right? They can be seen with the naked eye. That would include things like roundworm and tapeworms and pinworms and things more in strongyloides, things more in that category. Oh, I'm going to put Giardia in the protozoan category too. Giardia is something I'm sure most people have heard of. You get Giardia from contaminated water, like fecal contaminated water. And interesting thing I want to point out about Giardia is it can very much be, it's an infection, not opportunistic. It can very much cause acute classic infection symptoms, diarrhea, stomach pain, vomiting, right? Very classic symptoms. But the interesting thing about Giardia is it can settle into this low grade chronic infection. That's something I actually saw with a client who she came in for fibromyalgia type symptoms. She did have IBS type symptoms too, but she had fibromyalgia, joint pain, fatigue, brain fog, couldn't lose weight, lot of muscle pain, musculoskeletal pain. She had that for probably 20 years. And we ran a stool test, saw Giardia was measured, but not elevated. And again, Giardia is never normal to have. And I asked her about that and was like, hey, can you think of a time when you may have had what seemed like maybe food poisoning or like an acute gastroenteritis? And she was like, yes. I went to Australia. I was on my flight home. I could barely stand the flight home. She was so sick. She almost didn't even make her flight. So, and then she remembered it was kind of around that time, few months later or so, but that year roughly, that a lot of her other symptoms started. So what starts as an infection, we see this with SIBO too. What starts as food poisoning later and causes acute gastroenteritis later goes on to make changes within the microbiome and become a low grade chronic infection and disrupts the microbiome in other ways, problematic ways. Okay, so protozoans, helminths, right? Helminths are worms, protozoans are microscopic. So let's talk about testing, and I'm not going to get into specifics about types of parasites. I will say blastocystis is something I see not infrequently. Protozoans, I definitely on stool testing see more common. I don't think I've ever run a stool test in the 10 years I've been practicing nutrition that has shown up with a worm. I've never seen it on a stool test, but I've seen people passing them. So we know they're there. And that's what I'm going to talk more about in a few minutes. But protozoans will sometimes show up. again, I named some of the more common ones. Blastocystis I've seen, Indole maxana I've seen, but again, that's commensal. Dientamoeba fragilis I've seen. There was another one, Cryptosporidium I've seen. It's another waterborne, like contaminated drinking water, or playing in a lake and water gets into your mouth. That's another way. Playing in the ocean and water gets into your mouth like that. Let's see. And then, so those are not uncommon. And then as far as the helminths go, roundworms are pretty common. Tapeworms are more common than people would think. Pinworms are quite common, especially in kids. There's actually an over-the-counter medication that can be used for pinworms because of how common they are. And they can also be transmitted by pets. So those are some examples of the strongyloides. That's another more common one. Liver flukes is another more common helminth parasite. It's a fluke, not a worm, but that's another more common, macroscopic parasite, if you will. Okay, so now continuing into testing. So stool testing, I run on every person. I love the GI map stool test. We're really able to look at the health of a person's microbiome, their beneficial bacteria, their opportunistic microbes, bacteria, fungi. We do look at infections, bacterial, fungal, parasitic. We do look at, there is a parasite section. I'll come back to that. We look at their digestion and absorption markers, inflammation. You gain a wealth of knowledge. Okay, so I love stool testing. With that said, because of the life cycles of parasites, and because of the fact that they don't come out in every stool bowel movement, they are frequently not picked up on stool testing. Stool testing, it's one of those things, if they show up on the test, and especially when the person's symptoms and history coincides with that, fantastic, right? Fantastic that it showed up. But if they don't, it doesn't mean that they're negative. Whitney, that's great. I would do the same thing. I don't let my dog kiss me on the face either. I don't let him kiss my daughter on the face, or my dog is a female, her kiss my daughter on the face. Not about it. Love on your pets all you want, absolutely, but like maintain some kind of boundaries. And then 100%, if you find that your pets have parasites, it could be worth figuring out, what kind, and potentially needing to, experiment if your health has changed, or if it might be necessary to do a protocol for yourself too. Cats included. Cats can have toxoplasma, which is another microscopic parasite. Can be pretty nasty, really affect the brain and the nervous system. Okay, so continuing. So they don't always show up on stool tests, right? So how we get around that, and this is very important, is first of all, we appreciate the ubiquitousness of it. Secondly, I start to assess someone's red flag symptoms. So let me name those, and then I will also share other lab values that I look at, like in stool testing and blood work. Mostly those things. So symptoms, GI, obviously, right? So chronic constipation, chronic diarrhea, combination of both where they're alternating between the two, bloating, acid reflux, kind of the classic GI pain, that classic IBS, if you will, presentation. Skin issues, so eczema or psoriasis, chronic nutrient deficiencies like low iron, right? I've worked with a lot of people, mostly women, that will have chronically low iron. If they have heavy menstrual cycles too, that can absolutely play a role in that. But if they don't, and they have chronically low iron, despite eating meat, that's a red flag. If they have chronically low B vitamins. So this is something you can tell kind of on symptoms to some degree. So like numbness and tingling in the fingers, there might be kind of a rash or like a chappedness that starts in the corner of the mouth, dizziness, brain fog, fatigue, some examples of low B vitamins. On lab work, you can also look and see what their homocysteine levels are or mean corpuscular volume, basically the size of their red blood cells. MCH, MCHC, both of those, you can also look to see if those are low. That can indicate a B vitamin deficiency. So chronically low B vitamins is another one. Chronically low vitamin D, especially if they're supplementing. So if somebody's been supplementing with vitamin D and it is not raising, that is a red flag. Going back to symptoms, so more of the like histamine type symptoms, right? Because parasites elicit an immune response from a cell called an eosinophil. Eosinophils also mediate the allergic reaction or allergic symptoms. So if eosinophils are high on blood work, I'll kind of recap the labs I'm referencing, but if eosinophils are above 3 on blood work as a percentage, that's a red flag. But if they have allergy type symptoms, so congestion, sneezing, postnasal drip, sore throat, hives, like random idiopathic urticaria. So idiopathic meaning we don't know the cause of hives. Let's see what else. Allergies, more like the kind of the histamine intolerant symptoms. There can be migraines is a big one. Somebody that has migraines or frequent headaches. Itchy rectum is one. So it doesn't have to be constant. Like in kids that have pinworms, they will often have an itchy rectum at night, like every night, significantly itchy. It doesn't always have to present like that. It can be kind of intermittently itchy rectum, but enough where you're noticing kind of, what's going on. So itchy rectum is another one. What is that I'm thinking of? Ringing in the ears. The official name, it's totally blanking me. I keep wanting to say vertigo. It's not vertigo. Tinnitus. There we go. Tinnitus, ringing in the ears. So as you can tell, there's a number of different symptoms that come up, but I would say the big ones that raise my red flags are IBS type symptoms, joint pain, fatigue, brain fog, anxiety, eczema, and then those histamine allergy type symptoms. Okay. Now, and again, hello, the people that are joining me right now, I am so glad that you're here. And as I'm going through this, if you're with me live, you're welcome to comment. Let me know if you have any questions that come up. If you're watching the replay, tag me in it and add any, comments, questions that come up for you. Okay, so lab testing. I've kind of referenced some of these, but things that I will look at. So on blood work, I'm looking to assess someone's serum iron and their ferritin levels. Do they have iron deficiency across the board? Low iron, low ferritin? Do they have low iron, high ferritin? So low iron, but an inflammatory response, which would be the high ferritin. Do they have low vitamin D? So especially if it's below 30. Do they have signs of low B vitamins? So some doctors will test B12 or folate in the blood. It's not the best way to test for B vitamins, but if B12 especially is less than 500, it might be in the lab reference range, but if it's less than 500, that's low in my books. Rather, a better way to test for B vitamins is to look at homocysteine, or you can look at methylmalonic acid, which is an organic acid that reflects basically B12 levels. Again, mean corpuscular volume, MCV, if that's high, or mean corpuscular hemoglobin or mean corpuscular hemoglobin concentration, MCH or MCHC, has to look at the color and then the size and the color of red blood cells, respectively. That can also indicate B vitamin deficiencies. Of course, with the iron, if there's, looking at a CBC and if there's full-blown anemia, so low red blood cells, low hemoglobin, low hematocrit. We would also look at white blood cells. So next would be white blood cells. And if they're white blood cells in stool or blood. So in blood, if WBC, white blood cell count, is less than 5, but especially if it's less than 4, that's a red flag. If their eosinophils are high, again, another part of a complete blood count, that's a red flag. In stool testing, if their secretory IgA, which is a reflection of the gut's immune system, if secretory IgA is low or high, lab low or lab high, both of those would be indicators. And then again, in a stool test that runs something called eosinophil protein X, shows basically eosinophilic activity in the digestive tract, that would also be a red flag if that is high. If somebody's neutrophils in blood work is above 60 and it's not going down, especially from like more kind of easy interventions like nutrition changes, probiotics, things like that. I think that covers it. I think those are the big other lab markers that I would use to assess. So if somebody has these red flag symptoms, and then if they have these red flag lab markers that, think of another one. Chronic fungal overgrowth or infections that do not clear up, and SIBO that does not clear up. So if you've had confirmed yeast overgrowth, fungal overgrowth, or SIBO on labs, like confirmed in the stool test, in the breath test, your symptoms fit it. You've been doing all the antimicrobials, all the dietary changes, possibly pharmaceuticals, and it's just not clearing. That can be another indication of possible parasites. Okay, I think that covers it. So what do you do if you suspect this, right? What do you do if you suspect it? Let's say it's not showing up on stool tests, but you have all the symptoms, you have these other suspicious lab markers, or even if it is showing up on a stool test, what do you do? So there is an optional pharmaceutical route, obviously. There are medications that are specific for protozoans. There are medications that are specific for helminths. I am not a doctor. I do not prescribe meds. I'm not going to talk about the medications today, but just know that that's an option. A functional medicine doctor may be more willing to prescribe a medication without a confirmed lab finding if the other symptoms and lab values fit it and the person's history fits it. Certain, more conventionally trained and conventionally practicing doctors would probably want to see lab values that corroborate it. So I'll just put that out there. It's less likely that you could go to your doctor and be like, I have these symptoms and I think I have parasites. Can you prescribe me this medication? It's probably not going to happen. You can always try. But if you're working with a functional medicine doctor that's well-versed on parasites, they may be willing to prescribe a medication for you. Again, a lot will be more wanting to if they see lab values. Thanks, Whitney. Thanks for being here. I'm so glad that you joined. Okay, so what do we do? So there are a number of different parasite cleanses out there, right? I'm sure everybody sees this stuff on Instagram and TikTok. There are so many different possible protocols, companies that are advertising for parasite cleanses. I would highly encourage caution when using that and choosing something that you're going to self-guide through and experiment with on your own. For a number of different reasons, just not knowing, really what you're going after, what to expect, the quality of the herbs, the quality of their sourcing and reliability of their sourcing. Parasite cleansing can be kind of intense on many levels, emotionally, physically. So having the guidance with someone working with a professional of any kind is highly encouraged, not only for safety reasons, but also for efficacy. So you're not just spending a bunch of money and taking a bunch of supplements and it's not working, right? And it doesn't fit the problem. So, and to also help you make a thorough evidence-based assessment that parasites might be what's going on and be part of your picture. With that said, I will say there is value, and in a lot of cultures around the world do annual parasite cleansing, right? So I do see a value in that. I would just really encourage doing your research and your due diligence on the company and understanding their formulations and their quality and integrity of sourcing, and familiarize yourself on how to navigate a parasite cleanse. Okay, that aside, in my practice, I use Cellcore, period. I use Cellcore. Cellcore is, I know, I trust their purity, I trust their integrity, but not only that, they have blends that are, all of their products have their carbon technology, which is really, really effective at supporting the mitochondria and supporting the immune system and supporting cellular health and cellular inflammation, which all helps not only with the efficacy of the results, but the tolerance of the protocols, so that there's less chance of a die-off response or a significant flare while going through it. Doesn't mean it doesn't happen, but they're more gentle. They're better tolerated, in short. They're also very evidence-based, research-driven on their blends, their proprietary nature. So I love Cellcore. I'm not going to discuss specific protocols today. What I will talk about is the approach and the expectations. So Cellcore has protocols available. I will say the protocols that they have available are kind of baseline. So you can find them online on their website, but they're baseline protocols. So dosing for any kind of supplement is intended to be what the general population will benefit from. But with that said, they're I don't want to say conservative doses. There's room for advancement, we'll say. So their standard protocol is a great starting point. Uses para 1 and 2 and then para 1 and 3. And it's really important to support the drainage pathways and the immune system. It's like the liver, the gallbladder, the lymphatic system. Make sure you're having daily bowel movements, support the immune system while doing a parasite cleanse, which they also include in their protocols. But you can ramp up on the doses. You can change up some of the combinations of products that you use in order to get more thorough results. There is also a full moon component, so you can ramp up the intensity through taking higher doses or using different products together around the full moon. Concept being that the full moon increases parasite activity. And so you're more likely to be able to kill them because they will be more active during a full moon. And they have different protocols for that. But basically, the approach that we take is starting low and slow, going low and slow, and working up. So supporting nutrient density, supporting the drainage pathways, supporting health, having daily bowel movements, introducing the antimicrobial, antiparasite herbs. Must use binders too. Binders bind out the toxins that these parasites release. So start low and slow and then gradually work up. You can work up to either a specific dose or work up until parasites begin to be passed in the stool, kind of whichever one comes first. But then once the parasites start being passed, then you want to ramp up the herbs and then take a pause, and then ramp up and take a pause. Kind of look at it as like 3 weeks on, 1 week off, right? 3 weeks on, 1 week off, some kind of cadence like that. Not only to pause the herbs and so that they're more efficacious when you bring them back in, because parasites can form resistances, but also to give your body a break, right? And then you will start to see not only improvements in health, but the passing of the parasites will slow and then stop. And that's how you know that it's complete. There are situations where you might think that parasites are the case and there's nothing past, there's nothing that changes, and they may not be, right? It might not be that, but there is, as I was saying before, there is still value in doing annual anti-parasite cleansing because of how ubiquitous they are in nature and in our world. And then lastly, I'll say after doing the more intervention approach, then it's very beneficial to rebuild the gut. So come in with beneficial bacteria, prebiotics, nutrients to help soothe the gut lining, like the classic, aloe, marshmallow, glutamine, things like that, to support the gut immune system. Colostrum is wonderful for that. Again, different strains of probiotics to help build it and essentially turn the gut into an environment where these parasites can't take hold again, right? Because there's a big kind of goes back to the germ theory, right? It's not just exposure to the germ that causes the sickness. It's exposure to the germ and a compromised GI terrain or a compromised body, compromised immune system that allows that germ to take hold and cause sickness. So that's the second phase, if you will, is kind of turning the GI tract into a terrain that doesn't allow for that to happen as much as possible. All right. I think that covers it. What did you guys think of this conversation? What was your biggest takeaway? Again, if you have any questions or comments, don't hesitate to tag me in it, reach out. If you're listening to this thinking that, like, oh my God, I've been suspicious of this for a long time, I have a lot of these signs and symptoms, and you really want to learn more about it and take that evidence-based approach and not just guess and follow some protocol from Instagram, which I highly encourage, please feel free to schedule a free 15-minute discovery call with me. It's a phone call. Well, it gives us a chance to get to know each other better and talk more about the health challenges, goals that you're having, what you're looking for. I'll share what our practice process looks like and what the next steps involve. And if it feels like a good fit, then great. We'll talk about how to get started. And if not, that's okay too. All right, everyone. Thanks for being here. Have a great rest of your day. Bye.